Hey, Dr. Lowenstein here, and I thought we talked about types of implants real quick. I'm actually heading off to the operating room shortly, but want to do a quick review of the shaped silicone implants and the smooth round silicone implants and the saline implants. All of which are good implants. There's not one implant that's better than the others. It's just a matter of what's better for you depending on what you're looking for and the result that you're hoping for. You'll first notice that the shaped implant looks white because it's textured, it's got a rough surface, and the reason for that is that we want it to stick to where we're putting it. So we put it in and we don't want it to rotate because that's going to look kind of strange. So it's got a rough surface and it stays where we put it, which is an advantage if that's what you like, in that it's a little firmer than the other gels, and it doesn't move around. Normal breast tissue, when you lie down, will kind of move off to the side. When you stand up, it'll change shapes. This implant is made not to do that. It's going to stay where we put it, and be kind of a little bit more of a youthful appearance, which is great in women who don't have a lot of breast tissue to start with and are looking for a proportionate outcome that is kind of on the firm side. This is the gummy bear implant people often refer to. The other implant is the kind of gold standard, which is a smooth round gel implant, and this is a softer implant. It's made with a smooth shell, so it moves around very nicely and has a very, very nice natural appearing look and feel after surgery. The saline implant, also great implant, just different. First thing you'll notice of this is it feels a little different than the gels. When you hold it up here, you're going to see that there's some rippling, and that happens on the inside too. So when you're standing up, you can sometimes feel and sometimes even see some rippling, and it's something you got to be aware of with the saline implant. Now, the saline implant's advantages are, number one, it's cheaper, and it's cheaper for all plastic surgeons because it's cheaper for the plastic surgeon to buy, and usually that cost is passed on to you, that cost savings. So it costs us less, so it costs you less. Number two, it comes deflated. We put it in through a smaller incision and inflated on the inside, so you can get a little smaller incision out of this. And number three, when it deflates or it ruptures, you'll know it because the implant leaks saline. Your body is mostly saline anyway, so it just absorbs the saline kind of like an IV, and you'll notice that you're just smaller on one side, and you'll know that there's a problem there. The gel implants, so they feel and look more natural, they don't collapse when they rupture because your body doesn't absorb the silicone gel. So the FDA wants you to get a MRI after 3 years, and every other year after that when you have either of these types of implants, just to check on the implants and make sure that they're still in good shape. All of these implants in my practice we put in a dual plane pocket, so partially under the muscle, so we cover the implants with as much of your own tissue as possible to make things like a teardrop shape look and feel natural. It's kind of what we specialize in. And we use all three of these implants, and again, there's not one that's better or worse. It's just a matter of what you're looking for in your postoperative outcome. So I hope that helps. Again, it's Dr. Lowenstein in Santa Barbara, and any other questions that we can help with, always feel free to ask. Okay? Take care.